Good afternoon. I've been getting a lot of calls on the healthcare bill. I wanted to make sure I address your concerns. There's a lot of misinformation out there, and it's important to me that everyone in the 16th District and across Ohio has accessible and affordable health care. Remember, I have always been vocal and supportive of providing states and governors additional flexibility to pursue innovative ways to approach their health care. What works in California may not work in Ohio. We see this across the board on everything from energy policy to education to healthcare. So it's critical that states like Ohio have the flexibility it needs to offer Ohioans plans and choices that fit the needs of the residents. So let me start with the first question. Under this bill, 129 million Americans who have pre-existing conditions could be denied coverage. Rest assured that in American Health Care Act, insurers are not allowed to discriminate by gender or pre-existing condition, and no one can be denied coverage, period. That hasn't changed. States will have options to apply for waivers, but even if they are successful in getting the waivers, they still cannot deny coverage. Pre-existing conditions are an understandably emotional issue because families are scared of losing their plan or having a financial catastrophe if they develop a serious healthcare problem. I too have these same concerns. Again, this bill would not allow any state to deny coverage to those with pre-existing conditions and would require the extensive protections through high-risk pools. Let me read the second question. I hear people on the news talk about high-risk pools. Is this just a loophole for insurers to deny coverage? No, this is not a loophole, because as I have said before, insurers cannot deny coverage. Risk pools are designed to allow states to apply for waivers to receive greater flexibility to design their health care plans. High-risk pools are a fairer and more equitable solution to giving all Americans the right to choose or not choose health coverage. The AHCA sets aside $100 billion through 2026 to help states with high-risk pools and other innovations. It sets aside another additional $15 billion specifically for maternity care, mental health care, and substance abuse treatment. And it sets aside an additional $15 billion for a federal invisible risk sharing program, another innovative way to help people access affordable coverage. States can only receive a waiver if they avail themselves of the bill's $100 billion fund to set up high-risk pools. This helps these individuals and keeps coverage cheaper for everyone. Thanks again for reaching out, and I hope I've addressed some of your concerns.